Hi, everyone. Welcome. I am Angela Love-Zaranka with Lactation Education Resources. Thank you for joining us today for our Real Talk, the realities of being and becoming an IBCLC. Sekeita?
Good afternoon, morning, or night. I am Sekeita Lewis-Johnson. Thank you for joining us.
So I have been with LER for the past 15, 20 years as an instructor, and I currently serve as the program director. My background includes time spent in the community. I started from peer support and became board certified and I've worked in a hospital, I've worked in private practice, I've worked on different policy things with different international organizations on their boards of directors. And so I'm really happy to be with you today to talk about being an IBCLC. How about you, Sekeita?
Thanks, Angela. Well, let's see. I am an instructor for LER. I've been an instructor maybe for about 7 years or so. I am also the accredited provider program director at LER. I am a board certified family nurse practitioner, a former labor and delivery nurse, and an IBCLC. This year will mark my 15th year as an IBCLC. I have worked in a hospital setting as an IBCLC as well as in visiting nurses programs. I'm also have been a nursing instructor, so I've done it all, but all of it has been in maternal child health. So there's that.
Excellent. Thank you so much. So we're going to go ahead and get started, but just first a few little housekeeping pieces. So if you would like to ask questions and or comment, please take a look at the interface, the GoToWebinar interface, and you'll notice this bar which has questions. You'll see the little blue arrow there pointing to it. You can tap on that and type in your questions or your comments. If you're on a mobile device, it can be found along the bottom bar of the app as a question mark, as demonstrated by this green arrow here. So without further ado, we're going to go ahead and get started. Why don't you test out that little question box at this moment, and please type in there where you are participating today. Where in the world are you located? So we also have someone from our wonderful customer support team. We have Wendy here, who has been with us for many years and is very well versed in answering the basic questions on how to become a lactation consultant. Sekeita and I are going to answer some of those questions live, and Wendy will be taking care of the answers in the chat. We also have Jeanette, who is an IBCLC and who is also going to help us with answering some of those questions. And Jill is here to provide some tech support. So if there's anything that you need during the call, please let us know. We're happy to help. If you're watching this recording later on YouTube, you can post your questions in the comments below. You can also contact our amazing customer support team, of which Wendy is a member, at support@lactationtraining.com. Now let's take a look at what it is to become a lactation consultant and how you can follow your passion. If you become an IBCLC, you will join more than 34,000 IBCLCs in over 120 countries and territories around the world. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website. They have different regional offices depending on where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBLCE certification exam. What do you need to know? Well, the information that you're going to need to know is outlined in the detailed content outline. It used to be called the exam blueprint, and it's based on a survey of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That is the Lactation Education Accreditation and Approval Review Committee, which evaluates and approves lactation consultants training courses. Sekeita is going to take a moment and review a few questions to ask yourself as you're thinking about whether or not you want to become a lactation consultant. Sekeita?
Angela, so today we're talking about the realities, like the real realities, and I am here to really ask you to think about what your reality is, right? And so there's the reality to become an IBCLC, and then there's some questions that you will have to self-reflect on as we're talking and even after we're talking. So it might be helpful to write these down. So first one is, do I have these skills? So we're going to be talking about skill sets, not just in a way of touching, but and other thoughts and ways of being. So we're going to be talking about skills. And I want you to ask yourself, if you don't have these skills, where can you get these skills? How will you get these skills? And so really write these down. And again, you don't have to think about it right now because we're about to get ready to take a deep dive into some concepts about the realities and sometimes some things that we overlook when we think about the skill sets that are required. So write these down, reflect after you hear everything that we're going to bring, and then begin your journey. So, what makes an IBCLC? I'm going to talk right off the top about competency. To be competent means that you have the ability, the skills, and the knowledge to master a task, to do it successfully. And so when you think about the word competency, a lot of folks are like, oh, I know how to do it. But do you have the ability and all of the knowledge that it entails? And so I'm going to say that really, when you're first starting off as an IBCLC, one of the things is that you're starting at a novice level. So you should be competent in those things, particularly in uncomplicated and then some complicated cases, but you're not going to see every single complicated case prior to sitting for the exam. But you should have the knowledge to know, okay, where can I get this extra knowledge? What are my resources? And so in a sense, that's what makes an IBCLC. So I'm going to talk about some other skills. And as we talk about all of these skills, you want to think about, am I competent in this area? Or are there areas for opportunity where I can improve in this area? Or, yeah, this is great. I'm going to go here to get this experience. So let's dive in and let's see what skills I'm talking about. Culturally appropriate and credible. So remember I said ways of being, not just doing, right? So culturally appropriate is a little bit different, a lot different, I would say, than cultural competency. You will notice that earlier when I said master a task, one of the things the word competency implies when we talk about cultural competence is that we have mastered the ability to really be, I don't know, there's lots of cultures and subcultures. So culturally appropriate, I think, and there are other words you hear, culturally relevant are other words that really captures the spirit of what it means to be culturally humble or to deliver care that is defined by cultural humility, right? And so when we think about cultural humility is a lifelong process. It's a process that we truly understand who we are in this world as it relates to all the other concepts, the environment that we're in, the people that we're coming in contact with. So we have a really firm grounding, and that's a lifelong process, right? So when we think about, being having cultural humility, I'm going to give you an example. That could be, okay, this person has English as a second language. So do we have a language line, or what accommodations are we going to make so that we are speaking to this person and that the translation we know is a quality translation? Do you have a translation line? Do you have a translation app? Those sorts of things. So we want to make sure that we are providing care that really takes into account all the different areas and ways of being or language. And then we also know there's subcultures, right? So we can't really master someone's culture, but we can do our best to avoid things like, particularly in lactation, we can avoid saying things like, oh, it's not in their culture to do those things, because that's really not culturally appropriate, and that really may not be true unless the person has said, yeah, I don't do that, right? So we have to start thinking about cultures not as a monolith, but also thinking about, what's appropriate. How do I deliver appropriate care so that this person can maximize the opportunity to be able to make the best healthcare decisions for themselves? That's it. And then that's how you really become credible. So, one of the things about being culturally appropriate is you also want to be credible. A lot of times we, particularly in lactation and breastfeeding, we talk about, oh, when I breastfed, when I did this, right? So we know that we can't just rely on our own personal experiences. We have to be credible. We have to rely on the evidence. What does the evidence say? And then you have to say, okay, you know what? This was my experience. However, da 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 da, whatever the evidence says, right? And that's how you become credible. If someone asks you a question and you just start responding just because you feel the need to respond and you really don't know the answer, you also lose credibility. So it's best to say, you know what? Let me get back to you on that. I need to really find that out for you, and really honor what you're speaking and what you're saying, and is it steeped in credibility, is it steeped in the evidence, or is it steeped in bias, or steeped in your own personal experience? Policy advisor and creator. So one of the things,
Hi, Sekeita. It looks as if there is some internet issues going on here. Okay, great. So I'm going to go ahead. It's Angela. And I think that, all right, give us just 1 second here, working out these technical issues. I want to make sure that we hear every single word that Sekeita has to say. Give us just 1 second. Okay, great. So Sekeita was talking about policy. So one of those things that we do as IBCLC is that we do advise on policies and we help to create policies. And that's important to know because from a standpoint of talking about clinical care, remember Sekeita said, do you have the skills necessary? Well, what if you don't have, what if you do have those strong skills and policy? Then we're like, that's great. That's wonderful. Please, we welcome you to the table. We really do need those people who are policy, people who can write those policies as well as those advocates, because the language is something which is important. The language and the policies actually matter because that can influence how, especially those who are new to the work of maternal child health, can make a difference as well as how they can act. And so if you're a policy person, that's your thing, then please be at the table where the policies are being created. And what if that isn't your strong suit, but you really want to know how they are created and how they can impact us? Well, then that informs your advocacy, because advocacy is something else which sort of goes hand in hand along with policies. And advocacy informs a big part of what we do and who we are. And so the person that's an advocate is simply a person who publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, so to speak, you can be the person at the table listening to how policies are being created. And now I notice Sekeita is here, so I'm going to go to the next slide and see what she has to say about problem solver and researcher. Sekeita?
I am so sorry about that. I don't know what happened, but let's see. We're talking about problem solving. So remember I left off, well, I don't even know what you heard, to be honest. So we're talking about what's real. What's real is computer problems and glitches. So I had to problem solve in order to figure out how to get back on and how to make things happen. So, when someone asks a question, we are policy solve. We actually, when families come to us, sometimes we don't know the reason, we don't know all the things contextually that they're coming for us to solve, but it's usually some type of breastfeeding or chest feeding or body feeding problem. And they're expecting that we're going to help them problem solve and really help them figure out how to accomplish their goals. And so what that means is initially when you come, like I said, it's you come out, you're a novice. You're going to be relying on all of your resources and how do you problem solve and how do you maximize the time to problem solve. So that means that you may have to, if you're going to see a family to solve a problem, you may have to consult with some of the things. For instance, hyperlactation. Like, folks are making, what do I do for this? Where do you go for that information? How do you problem solve? Do you rely on the Academy of Breastfeeding Medicine protocols, right? How do you help the families solve the problems? Or do you just say, hey, go to this website where there's all of this mumbo jumbo language and medical language, and they're like, wow, this doesn't help me. So we're problem solvers. With that being said, we're also researchers. We are researchers. There's researchers who really do the research, this tech got me all off my game, but they do academic research. That's what I'm trying to draw from. They do academic research, but we are also researchers because when you problem solve, you automatically become like, okay, let me research this to help this family. But we do research, and there are lots of IBCLCs that have published data, that have published research, have done research. So really and truly, we are a field that's really versatile, and we bring all of these things, all of these skill sets to the table. High level lactation care and skilled. High level lactation care is really defined by the acuity of the individual and their baby. So, with that being said, when we think about the levels of lactation, we think about acuity levels. Right now, there's a framework that divides the framework up into three areas or three levels of care. And it really is basically matching the level of care with the level that the client and the family and the baby needs. So someone who's just having just challenges with latch, they can latch sometimes, not latch, and just need just a little bit of support with latching, that would be a level 1. And this is actually a framework developed by Rebecca Mano in Oklahoma. And it's also in one of the textbooks, I believe Wambach and Spencer. So with that being said, level 3 is a case where someone is probably in the ICU. Maybe they may be on a ventilator or breathing tube, something like that. But really what this framework does is it helps us determine what type of care is needed at the point in time. The higher the acuity level, level 3, the more time, the more skill, the more critical thinking, the more problem solving, the more advocacy, all of those things you're going to do more of when we think about a high level lactation care. So when we think about skilled, it certainly goes hand in hand because you're thinking, am I skilled enough right now to deliver care to for instance, a birthing person or mom that's in the ICU and their baby may be in the NICU. So we're taking into account both the maternal and the infant and what's happening together that's making this acuity level rise. And the point is the higher the acuity level, when you don't get the type of skilled care, that leads to premature weaning, early cessation of breastfeeding, and the family not meeting their goals. Essential and timely. Essential really became a buzzword during the pandemic. I'm going to ask you, don't let it become a buzzword for you. We are essential. We found that out during the pandemic because babies were still being born, and it was the height of the time that we should be delivering care to make sure that there is food security for our most fragile and vulnerable population, infants. They're born and they're born helpless and they need to eat, and their families sometimes need assistance and help because we have not truly normalized lactation, human milk feeding. And so we became essential, and we are essential. Well, I shouldn't have said we became. We've always been essential, but I think that the point of this is that when we miss the opportunity to show up in a timely manner, that means that a family may not be able, without the supports, to continue feeding human milk to their babies. And so, when we talk about level of care, essential, it's always timely access to skilled lactation care. That is what the aim is. That's what the goal is. And so we have to be timely. If a family 2-week waiting list are like, that's not a good thing, right? But if I can get to you in a day or two, and if I can't get to you in a day or two, and maybe someone else can get to them in a day or two, let's build our networks to make sure that folks have timely access. Collaborative care partner and trusted. It's important that when we walk into all situations that we understand we are collaborating with families. We're not the expert. They are the expert. So it's important that we center and we frame it when we go in because they know all about their situation. They know all about their background, their fears. They know everything. We come in and we're collaborating to do what's best for them. So, we talk about exclusive breastfeeding for the first 6 months. We know that, and most of us breathe that and want that for everyone. But the realities is that the structures are not all structures are not set up equally. So everyone won't have the same circumstances. They won't have the same opportunities, right? So we have to meet families where they are, and we have to collaborate to do what's best for them. And so when you go into families' homes, or when you go into the patient's room, wherever your setting or workplace is, and you walk in like you're in this hierarchical, I'm the expert, I know what to do, I'm going to tell you what to do, how it should be done. That's not collaboration. And that's not acting in the spirit of person-centered care. And the other thing is when you walk in with this assumed expert in hierarchy and you know all the things there is to know, and you're just going to teach and instruct and just do, people will lose trust in IBCLCs. And if they lose trust in you as an IBCLC, they may lose trust in other IBCLCs who are not all the same. We're not all the same, right? And so it's just to maintain the trust. Or when you walk into a room and someone says they need help latching, and you just immediately touch and start touching their baby or anything on their body, that is also a violation in how folks can lose trust. So really you're working as their partner, collaborating to do what's the best thing for them, their baby, and their families. So I mentioned person-centered care a few seconds ago. I've talked about culture, I've talked about care, I've talked about communication, and I've talked about collaboration. And the person is the center. So there is a definition from the Institute of Medicine, and it really is how we define our care based on the individual's family's preferences and values. So yes, we know that breastfeeding and chest feeding and human milk feeding is the most optimum for families. We have to really center all there is about the person to be able to deliver care that is person-centered. And we have to be able to really collaborate. Collaborate is key. We can do lots of things with communication. We can do lots of things about ourselves with care. We can learn about culture, humility. We can deliver care, but we have to be able to collaborate with other providers. And we have to be able to, along with collaboration comes trust and respect. And so with that being said, if you're seeing a client and this is, a client where you're like, I'm watching the weights, you want to collaborate with the pediatrician. You want the pediatrician to know, what was that feeding assessment like, right? That type of collaboration could prevent unnecessary recommendations for commercial infant formula. So you want to just have that level of care and respect, that the person is the center, the baby is the center, and that we're doing all of our efforts to make sure they have this sort of wraparound care. All right. So I began with 2 questions. I'm going to end with a few more questions. And these are also questions to consider. Angela is about to dive into the pathways. I want you to think about, from all of the pathways, really listen and think about each pathway before you determine what pathway is appropriate for you, because there are there's nuance to all of the different levels. And so she's going to talk about that. But also think about, you want to become an IBCLC. What does the local market around you look like? Are you saturated, or are there no IBCLCs? What does the local market look like? Where are you planning to work? And how does all of this training, all of the clinical hours, how does it fit your lifestyle right now? What all of the things that Angela's going to talk about, college courses, all of those things, and getting your clinical hours. Where are you in this present day? Are there some things that you may need to get off your plate first, or is your plate just clean and you're just ready to dive in? So consider all of these questions. I wish you a well journey on your journey to becoming an IBCLC. And I hope I gave you just a little bit of really and truly who we are at our core and what we do, because it is so meaningful. Angela, take it away.
Great, thanks so much, Sekeita. Okay, so now we're going to talk about the roadmap to the IBCLC. The process can seem to be just a little bit complicated, but I'm going to break it down and give you a nice roadmap. All right, so first you need to choose a pathway. Now we're going to come back to this in just a minute. Each pathway, there's 3 pathways, and each one has 3 components. The first one is education, the second one is clinical hours, and the third one is exam prep. Okay, so the first one, health sciences education. It's a typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list of the 14 subjects on the IBLCE website. You can search for it, or you can find a link in the resource which is attached to this presentation. The 8 university level courses are, and you don't need to write these down now, but they're biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person as long as the institution is accredited to provide the learning. If you took these courses during your college career, they count, even if it was 10 years ago. LER partners with Union Institute and University and Walden University to provide the basic courses. Both organizations are online. The advantage of working with Union is their program director is an IBCLC and has chosen the college courses which meet the IBLCE requirements. If you want to get your bachelor's degree in maternal child health with a concentration in human lactation, take a look at Union. Another advantage is both universities will accept federal financial aid. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control and basic life support. 5 of the 6 general ed courses can be taken through LER. The only one you're going to have to search for is basic life support. In many countries, there is an in-person skills check for this training, even though a lot of the didactic is online. Now, I have heard of some organizations providing this training completely online, so you want to check with your local resources. In the resources section, there is a link to the Health Sciences Education Guide. The guide provides general descriptions for typical courses in that subject area. Now, please keep in mind that the IBCLC is international. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited educational institution. That's okay. IBCLC uses broad terms with the understanding that there is no one universal description for what a course in, say, clinical research will cover. Why are these 14 courses required? The IBCLC is a standalone credential, meaning you don't need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career, as well as to pass the IBCLC exam. The second is lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the IBCLC detailed content outline. IBCLC requires at least 90 hours of lactation education, plus 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is lactation-specific clinical experience. Now, this can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. Also, lactation assistance to pregnant and breastfeeding clients, and lactation education to families or other professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. Now, how many clinical hours do you need? Well, that depends on your pathway. So as I mentioned, they need to be accrued in the 5 hours prior to applying for the exam. So pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organizations. Now, healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER and La Leche League International and the Australian Breastfeeding Association. As of today, there are over 40 organizations that have applied to and approved by IBCLC. Pathway 2 applicants, they must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 supervised hours working with breastfeeding and chest feeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. Now, the IBCLC, or all of them if there's more than one, must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning to accrue their clinical hours. Now, I understand that this happens relatively quickly, like within a few weeks. A quick note, for those of you who have breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends doesn't count towards the hours, your clinical hours towards the IBCLC exam. Now, while 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours just to sit the IBCLC exam. Candidates who are applying for the IBCLC exam through Pathway 1 need at least 1,000 hours. For the candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or another independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. Now, these hours do need to be counted on an hour-by-hour basis. So the two important points about clinical hours. The first one, it's important for you to document those hours as you accrue them. Be detailed in case IBCLC chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or other document where you counted your hours. And the second point is that the 1,000 hours do not need to be directly supervised. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding or chest feeding people and those providing human milk for their babies every day, such as a hospital or clinic setting. The hours count towards the 500 only when you're actually working with families. Observation hours don't count. Clinical experience is graduated. That is, it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. Now, LER has an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing that Amy wanted me to mention in this webinar is that you can't start to count your hours towards your internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend about 75 hours in orientation before they begin to accrue their 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk with others who've been through Pathway 3 to find successful strategies in finding a good mentor. Now, while this pathway has an additional step or two, is it worth it? It really is. It will see reports that students who come through Pathway 3 score best on the exam. I believe it's that mentorship that's the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. So as far as clinical hours are concerned, some people ask whether or not online actually is a way to accrue the hours. And the long answer is yes, and yes and yes is the long and the short answer. I will abbreviate the short answer. The longer answer can be found in the IBCLC documents, which are from 2020. They will allow that you can use technology in order to accrue your hours as long as certain parameters are met. The important point that IBCLC states is that there must be observation using technology with two-way synchronous audio and visual components. The focus is on the mentor providing the mentorship and the guidance to the applicant. Now, the guidance has been extended until 30 September of 2023. It's important to read all of the IBCLC documents listed in the interim guidance, such as privacy rules and the Code of Professional Conduct. The link to the guidance is found in the resource document in the handout section of the webinar. At LER, there are two ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or the bridge course. They're designed to meet your education needs depending on your background and previous lactation training. So first, our comprehensive course is called the Lactation Consultant Training Program, which is a 90-hour course, which is eligible for CERPs, which are continuing education recognition points from IBCLC, CME for physicians and other providers, and nursing contact hours. It's intended for those who do not have any lactation education and they want to become an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, authors, researchers who teach in our courses, including Sekeita and me. Our classes are economical. They can be viewed on a variety of devices such as your computer, tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We are discussing innovative ways for people to connect. Stay tuned for more information. Upon the completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. Now, if you're unsure where to start, or you have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Now, our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's at least 52 hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the exam. Topics in our bridge course include legal and ethical issues for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start and you're new to the profession, I would suggest the core course. Get your feet wet a little bit and see if becoming an IBCLC fits. Now, our 90-hour course, as well as the core and bridge courses, are available in Spanish. Capacitación en Lactancia is our new website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize one of the greatest barriers to entry to the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. We have tech support open 7 days a week. Get your questions answered by experts in the field, and we have ongoing support for the next steps in your lactation career. A good example is last week someone reached out to one of our instructors with a question from their own practice. We made the connection, and the former student received the answer to help their client. Another student had a question about creating a policy at their hospital, and we found the appropriate instructor to answer the question and provide additional resources. Thank you very much for your time today. Now, what questions do you have for us? I saw several of them in the chat box while I was chatting, while I was talking to you. Someone asked is it possible to work in a hospital setting? as an IBCLC without having some other sort of certification or credential or license. So I would say to that question, please do check with your the facilities in your area. Find out, who do they hire? Because in my area, indeed, it's relatively common practice. There are a couple of hospitals that do not realize quite yet that the IBCLC is a standalone credential. Therefore, they do require some other sort of certification or license. But we do our best in order to advocate for folks. And so that is one of the things that we do, is that if let's say that you do have a hospital which requires some other sort of certification, feel free to reach out and we can provide you with some resources. There's also the United States Lactation Consultant Association who has resources, as well as the International Lactation Consultant Association. So you can check with your region. There's lactation consultant associations around the world, such as LACANZ, the Lactation Consultant Association of New Zealand, the Great Britain Lactation Consultants, GBLC. There are lactation consultant associations in Europe, just all around the world. So do check with your local organization to see if there are any ways for which to advocate to become employed by facilities and those people who actually will respect and appreciate the IBCLC and help you to get a job. So someone else is asking here from Mexico City, can I still take the IBCLC exam if the 90 hours were not approved by LARC? And so I would say, do check with IBLCE. And I believe that Wendy popped that link in the chat. And so if you go to the IBLCE website, step 1, prepare for IBCLC certification and the lactation specific education, and they can answer your questions there. Someone else mentioned that their hours are more than 10 years old. Not a problem. 20 years old, doesn't matter at all. As long as you have those college courses, that's what matters the most. Now, there's general education courses that may be something which is a little trickier, and that's the reason why LER has them available on our website. Okay, someone else is asking about our internship program. So indeed, go to lactationtraining.com and you can search for our clinical internship program, and it's right there. Let's see, someone else is employed as a lactation support provider. And so how can they gather their hours? So indeed, you would want to take a look at the IBLCE website to see which pathway would work best for you. Frankly, if you have an IBCLC at that facility or someone who's willing to mentor you, by all means, please do take a look at that, and please do ensure that you are considered either a recognized healthcare professional or that you are, and when I say recognized healthcare professional, of course, there's so many different professionals which are out there, but you just want to make sure that it is according to IBLCE, that you're a healthcare professional through IBLCE, or the organization that you work with is recognized as a breastfeeding support organization. Okay, let's see. So again, our certified breastfeeding specialist, someone is asking about our certified breastfeeding specialist program. Indeed, we are recognized by IBLCE as a breastfeeding support organization. Therefore, you can become a CBS and earn your clinical hours through Pathway 1. So we're very excited about that program. We haven't announced it widely yet, but I guess my being here today and announcing it is something which is relatively wide. So please do share with all of your colleagues who want to become a lactation consultant and are trying to decide which pathway to follow. Let's see, do I have to show my health exam, my health courses prior to sitting the exam? And how do I know if they're recognized? As I said, if they are health science qualifications, if you took a course, let's say in biology many years ago, IBLCE will recognize that. And so in other words, it doesn't have to have the exact description, and that's why IBLCE is broad in its terms and doesn't necessarily say that it has to be exactly like this in order for it to qualify. So many of them do count. IBLCE, unfortunately, will not review your transcript with you in order to make that determination. However, it is something which most of those courses are going to count. And so a course in biology, clinical research, chances are it is going to count. Okay, someone states that they're not medical, and so how can they take the exam? Well, as I mentioned at the beginning, I come from a peer support background, and so I have been trained as exclusively as an IBCLC, and so lactation support is what I do, and it is something where I have worked in hospitals. I've worked in a variety of capacities, providing policy advocacy, both as volunteered and as paid. And so indeed, that's one of the reasons why taking courses like biology, anatomy and physiology, that's why they're so important. You know, newborn and child growth and development, those are so important so that you can answer some of those questions which may be on the IBLCE exam. It's to prepare you to be an allied healthcare professional. Let's see, someone is currently enrolled in college level courses, but they are not recognized by CAHEP. Will my classes still count? So yes, your classes will count because the college courses do not need to qualify for CAHEP. CAHEP, which is CAAHEP, that's an organization that accredits Pathway 2 programs. So Pathway 2 are specifically those where you say, I'm going to go to college and I'm going to get my degree in, you know, human lactation, maternal child health with a focus on human lactation. That's a very specific set program. I believe there's only, and I apologize if my number is slightly off, but I believe there's only about 8 programs that are Pathway 2 programs in the entire world. And so there are very few Pathway 2 programs. So it doesn't matter where you get your college courses, they do not need to be approved by CAHEP. It's not a problem at all. Someone else is asking if this recording will be available afterwards. Absolutely. This recording, we will send an email to you with a link to the recording in the next few days. So no worries if I spoke too fast and you want to listen to it again. Let's see. I'm currently enrolled in the IBLCE General Education Package through us. Yay. Would you recommend the additional core or bridge program? So that actually depends on how many hours, lactation specific hours you need. So that the general ed package that we have is under that sort of like the college courses and those general courses that you need first. And so that's what that is. So the second piece of that though, so that's something which is separate than the lactation specific education. So what do you have for lactation specific education? Count up all of those hours. And then, you know, if you've got the basics, then I would suggest that you take bridge. If you need the basics, such as anatomy and physiology and things like that, for lactation, anatomy and physiology of lactation, of the mammary gland and lactation, then you may want to take our core course. And then you'll also be a certified breastfeeding specialist at the end of the core course. So that may be something helpful. Someone else is asking if you can become a CBS with either. It seems like I said both, that you can become a CBS with the core course, as well as you can become a CBS with our lactation consultant training program, the 95 hours. And yes, that's accurate. So both of those courses confer the CBS. And so indeed, if you would like to become a certified breastfeeding specialist, you can take our 52-hour course, or you can take the 95-plus-hour course. It really depends on if you know for sure today, yes, I want to be an IBCLC, then go be an IBCLC and take lactation consultant training program, the 95-hour course. And in the interim, then you'll also be a certified breastfeeding specialist. Okay. Someone is asking, once I find a mentor, how do I get my mentorship approved? Well, that is something where you would need to apply to the IBLCE. You would need the mentor to sign actually, and to provide their IBLCE number so that you can actually apply to IBLCE to get that Pathway 3 program approved before you begin to accrue your hours. Okay, I'm currently training as a doula. Oh, yay, we love doulas. I love doulas. Would you say this would open more doors for me? It's advised to take a 20-hour course through the WHO through your doula training. Is our program compatible? Yes, our program actually will provide you with more than what you need. The WHO training is an excellent basic course. It's 20 hours. Ours is 54 hours. And so many doulas love taking our content as their training as a doula, because when you're done with both of those trainings, then not only are you a doula, birth doula, postpartum doula, full spectrum doula, but then you're also a certified breastfeeding specialist. So then you're qualified to provide support for the normal course of breastfeeding for those birthing patients that you have. Okay, this is great. Let's see, there's someone here who already has 50 hours, lactation specific hours. Yes, the bridge program is the best for them. IBCLC does have a form on their website by which to calculate your clinical hours. For those who are who are CBSs and who want to count their hours towards the IBCLC exam, we do have a spreadsheet as well, but the IBCLC one is probably the one that you want to use first. Okay. Can someone work exclusively as a certified breastfeeding specialist? Absolutely. You can work exclusively as a certified breastfeeding specialist. I would say, again, do your market analysis and find out what sort of work can you do as a certified breastfeeding specialist. And so, and remember that a certified breastfeeding specialist supports the normal course of breastfeeding. So if it's something, Sekeita was talking about, really those complicated cases, and talking about, the really challenging cases. And if it's something where you're supporting the normal course of breastfeeding, you're going to be doing that, you're going to be doing education and such, by all means do consider the CBS. If though you find that you want to do something and provide more support, more additional support, more for all levels of acuity, then do consider becoming, taking the time and becoming an IBCLC. And the reason I say that is because, as someone who's worked in both in the home as well as in the hospital setting, you really don't know what you're going to walk into. Meaning, I have been known to walk into, a home visit with a family. They state that it's, just a basic latch and positioning issue. And then I walk in the door and I see all sorts of things which are happening, where I'm grateful for the additional experience that I have and the additional training that I have to be able to support some of the more complicated cases. And so indeed, sometimes like if you're called to the ICU in order to offer lactation support, and sometimes you don't know. And so indeed, I would encourage everyone to be an IBCLC, because we need more IBCLCs who are culturally matched in the world. But I also do understand that sometimes, being a CBS is something which is your passion and is your dream, and offering that support and that education is something that you want to do. So I say that's great. Get your feet wet and try the 54-hour course and see what you think. Okay, the Rising Tide Scholarship. Is it for our didactic training, that 95 hours? And not the core and the bridge? Well, it's the Rising Tide Scholarship is to try to support and facilitate more people to become an IBCLC. So indeed, it is the 95-hour course, but it also includes the textbooks that you may need in order to become an IBCLC. It's also the exam fees. It's also, with one of our Rising Tide scholarships, we also will help, provide additional support for the college courses. And so indeed, it is something which it's very comprehensive to help folks to become an IBCLC. If you want to be a certified breastfeeding specialist and are looking for scholarships for that, feel free to reach out to us at support@lactationtraining.com, and let's have a conversation about how you can pursue your dream. Okay, someone is asking about QBank. So QBank is part of our exam preparation content, which we are very excited about. And all of our exam review content matches the detailed content outline. And so we actually have videos, I want to say it's about 38 videos, which go through different sections of the detailed content outline. And they provide that sort of comprehensive view, that sort of like Spark Notes or Cliff Notes, that sort of summary of each one of the sections of the detailed content outline. And it's broad terms such as infectious disease and things like that in both the infant as well as in the lactating person. And so it's going to be broad, but it's going to be very narrow. We have worksheets in there as well so that you can sort of like work along and fill them out. But specifically, this person is asking about QBank. And so we have over 560 questions in our online, you can take the test online and set it up so that you can take, let's say, a 20 question exam, or you want to take a 75 question exam. We actually have items, and you can go through those items, and you can do it in both test mode. So you're actually testing to see if you can get these questions right or wrong. But you can also do it in tutor mode, where we actually, teach you and say, oh, actually you answered A, but the correct answer is C. And then in the explanation, we explain why. Why is it? And so that's the nice thing about it. And someone is asking, how often do we update it? We actually update it like almost, I don't want to say in real time because that's not fair, but we do update it on a regular basis. So let's say you take a look at the answer and you're like, wait a minute, I saw a study from the WHO or some information from the WHO that is different than what's here in this answer and in the explanation. And you can put a comment in there, and we will take a look at the comments. I'm one of the people who actually takes a look at the comments, and they'll say, we'll take a look at that research and that URL that you've popped into the question, and we'll say, oh wow, you know what? We weren't aware of that. Thank you very much. And we actually will then either update the question, we'll update the response, or maybe we'll say, yes, that was information which the WHO had, 10 years ago, but when we actually take a look today, it's not accurate today, and here's the resource and here's the why. And so a lot of people really love that interaction that we have in QBank. And it is something that keeps us busy, and I like it because it keeps me on my game as well. I don't know everything about lactation. I do not at all. I've been doing it 30 years. I still don't know everything about lactation. And so there's that humility there. And I'm really grateful for the students who point things out to us. We do have a lot of people who say that our content and our questions are pretty close to what IBCLC asks. And so there's a lot of reasons why our questions are worded the way that they're worded. And if you want to know more, we have a few blog posts about it. You can actually, we've got a playbook blog post. We have several different blogs in that series. And so I highly recommend that you go and take a look at it, and it's going to answer a lot of the questions that you may have. Okay, let's see. That's great. Someone is asking about the difference between the CBS and the IBCLC as far as job activities and supporting families. Indeed, we have a scope of practice. The CBS has a scope of practice, and the IBCLC has a scope of practice. So you can take a look at both of those and sort of compare and contrast. And then what are the CE requirements to maintain your IBCLC? Great question. They used to say that you had to resit the exam in 10 years. Used to say that. They no longer say that. Now, every 5 years, you need to take a CE self-assessment so that you're actually taking a test, a 75-question test, and you take that test in order to determine, well, where are the opportunities that I have for additional education? Where did I score lower and where did I score well? And so IBCLC will provide you with will provide you with information on how to, what areas do you have an opportunity for growth? And then they'll say, okay, you need at least 5 CEUs in this specific area, 5 CERPs in this specific area, let's say in pathology. I need 5 CERPs in pathology. I took this exam, I scored really well on at least 80% or 75% in every single area of the detailed content outline except pathology. Okay, so then I need to go and take a look for organizations and actually you don't have to look far, just come to LER. And you can, we have the detailed content outline mapped according to all of our content. And so you can come and say, okay, what do you guys have on pathology? Oh, look, you've got this bundle of courses and it's 75 hours and it includes pathology. Great, I'm gonna take all 75 hours, because it's 75 hours every 5 years, with a focus on the area where you could use a little additional education. I'm going to get all of my 75 hours through LER, and the 5 hours of pathology is something which is covered. So done and done. Make it easy for you, because as I said, we're IBCLC, so we understand it. We feel it. We understand it. We know it. Okay, that's great. Someone is asking if they need to finish everything before they apply. Yes. Your college courses have to be done, your clinical hours have to be done, and your college courses, clinical hours, and your 95 hours of lactation-specific education. All of them need to be done. Okay, someone is asking, how do I know if I need 500 versus 1,000 hours? They're a CBS and they're in the health field, then indeed, I would say it depends on which pathway you want. Remember, the 500 is mentored hours that needs to be pre-approved before you can count your hours. The 1,000 hours is unsupervised. So 500 is pathway 3, pathway 1 is the 1,000 unsupervised clinical hours. And so that's the difference between the two. That's essentially the difference between those two. Someone is a licensed massage therapist. How do I know if my credit hours convert? Well, the question is are you talking about the didactic hours, or are you talking about the clinical hours? So that's a question. If it is your college courses, your college courses are going to count. If they are your clinical hours, it would depend on how much you're actually supporting lactating people and those providing human milk for their babies, breastfeeding, chest feeding, things like that. So that's sort of the difference between those two different hours. Okay, great. I think we've answered all the questions. Please make sure that you grab that handout in the GoToWebinar interface, where you see the questions. Underneath it, you should see the handouts. And so by all means, please do take a look at the handouts and download it. If you have any other questions, you can reach out to support@lactationtraining.com. And then here are a couple of more questions. Let's see real quick. Can I take a la carte courses, including and bridging core courses? Absolutely. All of our courses on the LER website are a la carte, so you can take them, pick and choose, see which ones you like. We've got some really great ones in there. To be clear, for Pathway 2, completion of the necessary clinical hours are built into the respective programs. Yes, for Pathway 2, the clinical hours are built in with the didactic, with everything that you need. It's one-stop shopping. As I said, there are only 8 in the world, so please do take a look at those. What are some examples of Pathway 1 mentoring and support groups where we can get hours? Well, LER is one of them. So you can reach out to us and we can provide you with more information, or you can go on the IBCLC website. Let's say you're in a different part of the world and you're already part of a breastfeeding support organization. Then go to the IBCLC website and see if your organization is considered an approved breastfeeding support organization. Do the 14 health sciences need to be taken prior to our 95 hours? Nope, you can do them concurrently. Again, as Sekeita said earlier in the call, it sort of depends on, though, your capacity, right? Do you have the capacity to take those college courses, to take those general ed courses, and to do our 95 hours? So that's the question that you need to answer for yourself. Do you need to get 100% on the IBCLC exam? Heck no. The passing score is something which actually changes from year to year based on a variety of factors, which we have a blog post for. So you can take a look and see what that is, but it's generally in the range between, I want to say, around 75%. So if you score about 75% on the IBCLC exam, chances are you will be an IBCLC. Registration for the September IBCLC exam, actually the window is open now. I think it opened May the 10th. And so from May the 10th until early June, I'll allow Wendy to type in the answer to the question that I'm looking at so that I can make sure that I'm right. I think it's from like May the 10th until June the 10th of 2023. That's when we're recording. And so that window is open in order to apply for the September 2023 exam. So that's another important note, is that the application window opens several months prior, and you have to have everything done before you apply for the exam in case you're audited. And so do be mindful that you need to have everything done before you apply for the exam. I believe for the March of 2024 exam, the application window is open towards the end of 2023. I think it's from like November to December, but don't quote me on that one, or I won't even quote myself. Go to the IBCLC website and make sure. Okay, that's great. Wendy just put it in the chat, which is good. So indeed, the key dates can change, so you do want to check on their website. Someone is asking if they can get an unofficial transcript before the exam. I'm not sure I understand that question, and so if you'd like to reach out to, I don't know what unofficial transcript you would need, if it would be from us or from the colleges. You would have an official transcript. You don't need to provide IBLCE with your transcripts when you apply for those college courses. You don't need to provide them with a transcript. What you do need to do is say that you have those hours, and then if you're audited, provide proof. Someone else is asking, is the IBCLC exam online or at a specific location? It is online at a specific location. There are, I think, possibly a few folks around the world who do not have access to computer-based testing who may still be taking the exam pencil and paper, but it is online. I do know that some people either will go to a testing center if there is one within a certain number of miles from their home, or you can do it live remote proctoring is something that it's called. And so indeed, you would want to go to the IBLCE website in order to find out what those options are. Someone is asking, how do I find a testing center if they're in Africa? And indeed, I did see when you came in that you are in Zimbabwe. So Zimbabwe is one of those places I look forward to visiting, hopefully in the near future. And so indeed, I would suggest that you reach out to the IBLCE regional office for your area. I believe that was going to be the office in Europe. And again, if you go to the IBLCE website, you can find out which regional office is appropriate for your country in Africa. So great. This has been so much fun. I hope you've enjoyed it as much as I have. Thank you very much for your time today, and I hope you have a great rest of your day, rest of your evening. I'm going to take just one more moment and answer this question. Well, I'll say it out loud. So someone is saying anatomy and physiology. Would those hours count towards any hours? Our course on anatomy and physiology is focused. So there's anatomy and physiology in general that you take through a college, post-secondary education, anatomy and physiology. Our anatomy and physiology is lactation specific, and it's included in the 95 hours or in the core course, either in the 52 hours as well as in the 95 hours. And it is specific to lactation. So anatomy and physiology specific to lactation is part of those core things that you need in order to get those 95 hours to sit the IBLCE exam. So it may seem like, oh goodness, I have to take anatomy and physiology again. But remember that anatomy and physiology as a massage therapist is slightly different than anatomy and physiology from a lactation perspective. Anatomy and physiology from lactation is super hyper focused. And so it's much narrower than the training that you've had in anatomy and physiology as a massage therapist. Okay, great. Now really I'm done. I'm done now. Have a great rest of your day, everyone. Thank you so much for joining us.